All right, let's talk about something many of us have had, but probably never really thought about. Surgical stitches. That simple little thread? Well, it turns out it's not so simple. It's actually a mind-blowing piece of medical engineering. So let's get into it. You've probably been there, or know someone who has. You get a cut stitched up, and then you're left wondering, do I have to come back to get these things taken out, or are they just gonna disappear? It's a super common question. And the answer to that simple question? Well, it opens up this whole hidden world of material science. It shows how these threads are cleverly designed to do very different jobs, both inside and outside your body. This is way more than just closing a wound. It's about healing in the smartest, most efficient way possible. Okay, so at the heart of it all, you've really got two fundamental types of sutures. Let's call this a tale of two stitches, because once you understand these two main characters, the whole story of how surgeons help us heal just clicks into place. First up, you've got your absorbable sutures. These are pretty much the magical, disappearing stitches. They're made from materials your body can actually break down and absorb over time. Surgeons use these deep inside the body, like for internal organs or deep tissue layers. I mean, can you imagine having to go back in for another surgery just to get your stitches out? No, thank you. And on the flip side, you have the non-absorbable sutures. These guys are the heavy lifters, built to last. They're usually made of stuff like nylon, and they provide really strong long-term support. You'll find them holding skin together or repairing high-stress areas like tendons. They need to be tough and reliable. And yep, these are almost always the ones you have to go back to the doctor to get removed. So let's just break this down side by side. It makes it super clear. Absorbable, they dissolve so no removal needed, and they're perfect for short-term support inside the body. Non-absorbable, they stick around. They usually need to be removed, but they give you that long-term strength you need for skin and tougher tissues. It all comes down to one thing. How long does that specific part of your body need help holding itself together? And check this out. This is a perfect example of how both types can be used in the very same cut. A surgeon might use an absorbable suture to stitch together the deeper layer of skin, the dermis. That's like the foundation. Then they'll switch to a non-absorbable suture for the outer layer, the epidermis, to get a really clean, precise closure that leaves the best possible scar. And just when you thought that was it, nope, there's another layer of complexity. Sutures also come in two different structures. You've got monofilament, which is just a single smooth strand. Then you have braided, which is a bunch of smaller strands woven together. The smooth, single strand glides through tissue easily with less risk of infection. But the braided one? It's stronger, way more flexible, and holds a knot like you wouldn't believe. It's a classic engineering trade-off. Do you want smooth and safe, or strong and easy to handle? So we've talked a ton about the thread, but a suture is nothing without its partner in crime, the surgical needle. It's so easy to overlook, but believe me, the needle is every bit as precisely engineered as the thread it carries. Needles come with different points for different jobs. Think of it this way. Cutting needles have this sharp, triangular tip designed to slice right through tough tissue, like your skin. But then you have tapered needles. They have a smooth, round point that actually separates tissue fibers instead of cutting them. That makes them perfect for more delicate stuff, like in cosmetic or GI surgery. So a surgeon's choice really boils down to a quick two-step process. First, they pick the tip based on the tissue, cutting for tough, tapered for delicate. Simple. Second, they choose the curve of the needle itself. If they're working deep inside a tight space, they might need a sharp half-circle needle. But for a wound right on the surface, a gentler curve is all they need. And really, at the end of the day, all of this super specific needle design is about one single goal: passing that suture through the tissue while causing the absolute minimum amount of damage. Because less trauma means faster, cleaner healing. And that's what we all want, right? So how does a surgeon put all these pieces together? Absorbable or non-absorbable, single strand or braided, cutting needle or tapered? Well, it's a really complex decision that's tailored to every single patient and every single wound. They're weighing a whole bunch of factors. They're thinking, okay, how fast does this tissue heal? How deep is this wound? Is it on a joint that moves a lot? What's the risk of infection here? And, especially in visible spots, what choice is going to give the best cosmetic result? It's a true blend of science and, honestly, a bit of art. This quote from Merrill Life Sciences really just nails it. There is no single best suture. It all comes down to the surgeon's expertise, their judgment, and their ability to match the perfect tool to the specific job at hand. All right, so the stitches are in. The hard part's over. So what happens next, and what are some of the potential hiccups along the way? So the whole reason for a suture in the first place is to hold the edges of a wound perfectly together. This allows the body to heal by what doctors call primary intention. And that's the ideal scenario. It's the fastest, cleanest healing process, and it leaves the smallest possible scar, because the tissue can just fuse back together directly. But of course, things don't always go perfectly. Complications can happen. An infection is always a risk. Sometimes the body can have a bad reaction to the suture material itself. In really rare cases, a wound can reopen, a knot can fail, or you could get some excessive scarring. And this is exactly why the right material choice and a surgeon's technique are so incredibly important. And to give you one last idea of the incredible precision we're talking about, just look at the range of sizes. Sutures go from a thick #5, which is about as thick as a tennis racket string, all the way down to an 11-0. That's 11-0. And get this, it's finer than a human hair. It's used for the most delicate surgery you can imagine, like on the human eye. So the next time you see a simple stitch, what are you going to see? Is it just a piece of thread? Or is it the tiny, elegant masterpiece of medical design that it truly is, representing centuries of innovation, all working to help us heal? Something to think about.